Hi students, welcome to Health Politics and Policy. We are in Unit 1. In Unit 1, I'm just going to give a couple highlights on health insurance. Healthcare politics shapes every aspect of our healthcare system. The politics operate in two very different ways. First, proposals for large-scale change provoke some of the fiercest battles in all American politics regarding health insurance. When President Barack Obama introduced his Affordable Care Act, also known as the ACA, in 2009, it ignited a long political conflict that quickly spread to include the hot bottom issues of American politics: immigration, abortion, socialism, and social justice. The debate, as you will see, echoed previous conflicts going back to the 1930s and before regarding healthcare. The second area is that between the big healthcare debates lies a calmer political process. Most decisions involve quiet, technical analysis and sober judgment. However, healthcare debates, big and small, involve the same institutions. It involves Congress and the President, lobbyists and the courts, the states and the public, as well as business and insurance companies. The biggest healthcare payer in the U.S. is the government. The government pays for almost 50% of all American healthcare spending. The government spending mostly comes from two programs: Medicare for people over age 65, and they pay 20% of the total healthcare bill, and Medicaid, which is a rapidly changing program and it's originally been designed for the low-income people, pays for 16%. All other federal, state, and local programs, including Defense Department, Veterans, Public Health, School Health, Workers' Compensation, and federal spending on medical research, is another 14%. Traditionally, working people get their health insurance through employers. Private insurance counts for 33% of all healthcare spending. The government has a larger share of the spending pie than the insurance companies. Even private insurance is not a completely private matter. Congress uses tax breaks to induce employers to offer health insurance to employees. There are no taxes on employer-provided health benefits. In contrast, if the employer paid the same amount directly to the employees so they could buy their own health insurance, the tax breaks would not apply. The tax subsidy tops $130 billion a year in foregone revenues. So for this presentation, I just kind of provided you some basic facts on health insurance and what has changed over the years, as well as who is the primary spending in healthcare today. So for this week, you need to complete your lecture review. Please review your discussion board postings and respond to other classmates' postings, and then double check your weekly units so you know what assignments to prepare for this week. If you have any questions, please let me know. Otherwise, have a great week.